stay-at-home order, assisting local law enforcement and state's attorneys in their work to keep people safe. The majority of states, from our Midwest colleagues like Ohio and Wisconsin to other Republican-led states like Georgia and Florida, have or have had a broader range of enforcement mechanisms relating to their stay-at-home orders. This temporary emergency rule brought Illinois in line with this national practice, giving local officials more flexibility in their ability to enforce this order with a simple citation. That flexibility is the critical piece of this. The state already has enforcement authority through an IDPH closure order or the revocation of a business license. But those tools are harsher measures than anybody, including me, is interested in pursuing. A business that chooses not to follow the rules can recover from a fine. It is much more expensive to deal with being stripped of a license or forced to close. The General Assembly has now returned to its operations for the first time since March, and in consultation with leadership in the State House, my administration has decided to withdraw this rule in order to pursue legislation with the same intended mechanism in a phased manner, in line with the Restore Illinois plan. Enacting this measure through legislation will allow us to have these tools throughout the Restore Illinois plan versus an emergency rule that would be withdrawn and rewritten at the start of phase 3 and then phase 4. I'm here today with Illinois State Police Director Brendan Kelly, as well as leader Bill Cunningham, who is sponsoring this legislation. I urge the General Assembly to take up and pass this legislation this week. Given the importance of what we are trying to do here, we will look to file an additional rule if legislation does not occur. Our only goal here is one that we all share: prioritizing public health while reducing the harm that bad actors can cause the broader small business community, so important to the strength of our economy. And with that, I'd like to turn it over first to Leader Cunningham.
Thank you, Governor, and thank you for your leadership throughout this crisis. My name is State Senator Bill Cunningham. I'm the state senator for the 18th district that covers the southwest side of Chicago and several southwest suburbs. I want to focus on a point that the governor just made, that being that the legislature is back in session this week. As we all know, that has not been the case for several weeks. In the absence of the legislature, the governor and his administration, the various agencies in the administration, have had to promulgate emergency rules. Many of those rules are meant to be aligned with the governor's executive order related to staying safe during the coronavirus crisis. By virtue of the fact that we're here in town, we've talked with the governor, both the members of the Joint Committee on Administrative Rules, which I am the co-chairman of, and the leadership in both chambers, and we think it's appropriate that we deal with this problem through the regular legislative order, and that's what we're committed to do this week. I think I can speak for myself, and I believe a number of other legislators, that we agree with the intent of the Department of Public Health when it comes to enforcing the governor's stay-at-home order. We've had some disagreements about the exact process, but now we'll be able to delve into those things here in the legislature. That's the way the process is intended to work, and we're looking forward to working with the governor on developing, I think, a really important and sensible piece of legislation. And with that, I would ask the Director of the Illinois State Police, Brendan Kelly, to come to the podium. Thank you.
Thank you, Governor. Thank you, Leader. I wish I could speak the beautiful, fluent Spanish that Dr. Ezequiel does every day, but I do speak a couple languages, but all very badly, including English, so I will do my best to try to articulate to all of you today where law enforcement has been through the pandemic and where we are today. Let me just first say, the men and women of the Illinois State Police, indeed all law enforcement throughout this pandemic, have done simply an amazing job. the level of professionalism that they've shown, the compassion that they've shown, the patience that they've shown in an incredibly difficult situation is something that we should all be grateful for and something that we should all be very proud of. This is probably the most difficult public policy problem that law enforcement has faced, certainly in our lifetimes. Balancing the need for public health and public safety, as well as the need for personal rights and personal concerns and the ability for people to live their lives. This is an extremely difficult problem, and the men and women of law enforcement have risen to the challenge at every stage to do everything they can to protect the public health in these very difficult circumstances. Now, during this phase, during the pandemic, the word enforcement and law enforcement has come to mean many different things. And so let me just remind everyone what the incremental steps are, the various actions that have been taken by law enforcement, both at the Illinois State Police and throughout the state, locally, federally, at every level in terms of enforcement. And that has always begun with a conversation between the members of law enforcement and the public or businesses that may be not complying with the health requirements that have been put forward by the Department of Public Health and through the executive order. That increases to perhaps a verbal warning or a written warning or a notice to cease and desist that type of activity which may be violating the health guidelines that have been put out by the Illinois Department of Public Health. Eventually that moves to the level where you have an impact on someone's license. We have worked, the Illinois State Police and other agencies have worked with state agencies like the Liquor Commission, the Department of Public Health, DCEO, Illinois Department of Financial and Professional Regulation when it gets to the point where that conduct is impacting someone's license. There's also been the process of working with local health departments to initiate temporary restraining orders or closure orders. Let me say, from the very beginning, it has been the governor's intent and the governor's direction from day one that no one be arrested, no one be taken to jail, no one be put in that situation for violating the conditions of the executive order or any emergency rule. And that is the case today. The Illinois State Police have not taken anybody to jail for violations of the executive order or for any of the conditions related to emergency rules promulgated by any agency during the pandemic. It has also been understandably clear that everyone is reluctant to pursue a full closure order and completely shut down a business and put that business out of business for whatever period that may be. That is a pretty harsh remedy, and there's not anybody who has it in their heart to want to pursue that remedy in the event someone is violating the health rules that have been put forward during the pandemic. In addition, there's been no one who's had a desire truly to be able to pursue violations of the licensing requirements. No one wants to take somebody's liquor license permanently and put that business out of business. Absent that act, absent those measures, the Illinois Department of Public Health Act, which has been in the book for many years, we are left with enforcement of any type of rule that falls under the Illinois Department of Public Health Act. Now, the senator, the leader Cunningham, and the governor, as they have mentioned today, are moving forward with some type of legislation. What's important is that we get what all law enforcement has been seeking throughout this process, and that we hope to see at the end of this process is consistency, clarity, and fairness. And now that the legislature is stepping up and offering something in addition to what we have in the Health Act, these emergency rules, we will work with them, we will work with the administration, and we will work with all the legislators to provide some type of feedback and process going forward so that we have that consistency, so we have that clarity, so we have that fairness. The men and women who serve in law enforcement are in an extremely difficult position, but they handle it very well. They handle it very smartly, and they handle it very patiently. And we need to give them the tool as this process moves forward so that we have consistent outcomes, and we have fairness, and we have clarity. And now that Leader Cunningham is stepping up to move forward that, we look forward to working with him, and of course encouraging all sheriffs, local police departments, state's attorneys to provide input on that process as well. And we hope that will get us through the next phase, and we're all very much looking forward to the next phase. God knows I need a haircut, so I appreciate appreciate everyone's patience. And again, if you see someone who's working in law enforcement, don't go up to them violating social distance, but tell them if you can, say thank you for what they're doing, because their job is extremely difficult, and we all need them to continue to be safe and healthy so they can keep everybody else safe and healthy. So thank you.
Thank you, Director.
All right, we'll start with you, John, then we'll go to Mark and we'll go online.
Oh, thank you. Hi, Governor. Welcome back.
Hi, John. Nice to see you again.
Thank you. Bear with me. I haven't seen you for a while, so my questions go back to mid-March.
Well, you've been asking questions.
First
I've heard
question
your
is
name
from my
called.
mother, who's seen my hair and wants me to ask you where you got your Flowbee.
I never was able to get a hold of a Flowbee, although
Yeah,
I
they're
know
all
that
over
a
eBay,
colleague of yours in the media happens to have one, so we may need to borrow his.
They're, given the style choices that many of us in the media get, there probably is a Flowbee around. First question, a lot of questions about the J-Car rule from Greg Hines of the Cranes and Rick Pearson of the Tribune and Doug Finke of the State Journal-Register, and Mark Maxwell added one in our collusion beforehand. Those have been answered in large part, but I guess what remains is for you or Senator Cunningham to explain what this new bill will do and why you think it will have Republican support, or do you care whether it has Republican support?
Well, I would go back to the original intent here anyway, which is to make sure that we had some enforcement mechanism. And as I've said all along, nothing that would involve arresting somebody. It's really an ability to issue a citation of sorts. But I want to turn it over, if you don't mind, to Leader Cunningham for his input, since he's going to be the sponsor. He is the sponsor.
Thank you, Governor. I think it's fair to say that there was a bit of an overreaction to the original rule. And that, I think, was created by the fact that it referred to a Class A misdemeanor. Now, as the director said, never any intent to see anyone arrested. There is a provision of a misdemeanor that allows for a fine. That was the intent. That was the intended enforcement tool, not a criminal charge that would end up in detention. So we want to clarify that that is not part of our effort, that if there is any sanction in place, it would not be anything beyond a fine that would be adjudicated in the civil court system or through some administrative system and not through the criminal courts. We also, as has been mentioned, want to avoid revoking licenses. That could have, I think, a long-lasting negative effect on a business. What we want to have is something that our public health departments and the police departments that they work in concert with, to have tools to enforce the stay-at-home order, make sure businesses are following aspects of that order. And I think it's fair to say we would like to do it with a soft touch. That is the intent of the legislation. Obviously, we will go through the process with both chambers going back and forth. But again, we're looking to land on the intent of the rule. We'll just do it through the regular lawmaking process.
Governor, you've been challenged on your executive authority before. Was this one where you finally said, I'm not going to die on this hill, that let's let the legislature have a say?
No, I think the leader really expressed it well. You know, the challenge of the existing legislation, which was originally enacted, I think, in the 19th century, is that it only allows for a Class A misdemeanor. And that's a pretty large amount of latitude, as some have pointed out, right, that even as much as potentially jail time, although, again, that was never my intent. And you can go back to press conferences 2 months ago, and you would hear me say that it's never been my intent to have law enforcement to prosecute somebody or arrest somebody, put them in jail. You know, we wanted to have some kind of enforcement mechanism, and I think a citation is the right way to do it. I think the senator has described it well. And, you know, we've never looked for the maximum penalties under even a Class A misdemeanor.
The committee met in pre-meeting for 3 hours. This is the kind of thing that taxpayers, it just riles them. They want issues debated, and they want it to be open. Why was your staff in that meeting? Was any of your staff in that meeting? And why don't you condemn that kind of lack of transparency?
No, I would just say, I mean, I think that the JCAR, I mean, we can talk about the procedures of JCAR, but, you know, I think they were just contemplating what the options are with regard to an emergency rule.
In secret.
Senator, yeah.
In secret.
So I want to, JCAR is, I think fair to say, a somewhat obscure legislative body. I want to just explain a little bit about it first. It is really a bridge between the legislature and the executive branch. We pass bills in which we give rulemaking authority to agencies. The agencies then promulgate those rules. JCAR looks at those rules and determines whether or not we believe they're in compliance with the law. It is, the process contemplates cooperation and negotiation between the legislature and the executive in this area. It is not uncommon at all for an agency to submit a rule and for JCAR to engage in discussions with the agency promulgating the rule and maybe not be completely happy with what they've proposed and urge them to amend that rule. That happens all the time. We did that today with a rule that the Secretary of State's office submitted. So this is essentially a negotiation, like something that goes on every day in the legislature between the executive branch and the legislative branch. When we take any action, those actions are taken in public where it can be viewed by citizens. That's what happened today. That's what has happened all along with the JCAR process.
Governor, the new rule on outdoor eating and dining was exactly what a bar, tavern, restaurant in the Quad Cities was doing. And I think they sued you. There's a lawsuit because they were shut down. They had picnic tables 10 feet apart, and they were serving carry out, and then the patrons were. Did that restaurant's experience or any other restaurant's experience help, you know, make you look at it again? And if it did, why not give them credit and say, look at me, I'm open to suggestions?
I've been listening to restaurateurs and bar owners for quite some time. I've known Sam Toya for more than 20 years, 25 years. I am, know quite a number of owners as well as people who work in those establishments, and I have been listening all along here because I want to do the right thing. The most important thing is that we've got to make sure that the epidemiologists, the experts here, feel that we can execute this in a way that keeps people safe. That's the number one consideration. That was why we originally had to close bars and restaurants, because the feeling back then, without knowing much about this novel coronavirus, was we needed to stop restaurants and bars while we figured out what the best way to proceed was. And even now, as you know, there are challenges, and the restaurant industry has been terrific at proposing safe ways for people to dine and to go out and enjoy themselves. And the summer offers us the unique opportunity, according to the epidemiologists, for us to begin to bring those restaurants back online. So the credit really goes to the leadership of the industry. It goes to the many restaurateurs who, frankly, have been good actors all along. And remember, this is 9 days away. So those people who have tried to flaunt the rules don't, in my opinion, deserve to be rewarded. But I think the entire industry has acted in a proper way. The vast majority, just like the vast majority of Illinoisans, have been doing the right thing to keep people safe.
All right. Follow-up from Jim Leach from WMAY. Do you feel that not getting legislative involvement, especially from Republicans, in the stay-at-home and shutdown orders has contributed to a growing backlash against these orders? Should you have sought more legislative input sooner?
Actually, I've been speaking to legislators throughout this process.
They don't. They say they can't get any epidemiology studies. They can't get access to Dr. Ezike.
They've actually,
the House Republicans say they can't get any documents out of you, and we say the governor says this.
That's not true. How many press conferences have I had? I've held up. I've shown
they say they
with
have
the
access
experts.
To, right. And the one day that you held up the one day you held up the model, you said this is all available at the governor's office. Come see it.
No, that's not true. Here's what I said. Excuse me, yeah, the lawmakers got a briefing about it. But let me just say,
On that
what I
model.
said was
All right, I believe you then.
yeah, we have, as you know, 3 different groups of experts who were bringing forward their models, and then we had a number of epidemiologists that we brought forward, and we even provided for Republican legislators, as well as anybody else who wanted to join, the ability to ask questions of those experts. And they did, and it was a satisfactory event. Nobody complained during the event or even after the event. Maybe now, because they're acting in a hyper-political fashion, they now want to complain.
This question is from Charlie Meyerson at Chicago Public Square. Please elaborate on the decision to exclude Amy Jacobson from these media briefings, and please explain the guidelines going forward for determining who will be allowed and who will be excluded.
Hi, it's Jordan, the press secretary. That was my decision, and so if he has that question, I'll take that in my inbox later. The governor doesn't make decisions on his press conferences, that's my job.
Well, did you agree with the, you agree with that, though? You could overrule her.
Look, when you stand up at a rally where people are taking a political position, holding up Nazi swastikas, holding up pictures of Hitler, and taking an extreme position, as she did, it strikes me that that's not objective in any way. It's not the way you act. It's not the way that your colleagues in the media act, who are reporters. That is not a reporter. She represents a talk show that has a particular point of view. We allowed her to ask questions because once upon a time she was a reporter, but she proved that she is no longer a reporter.
Dr. Zike could probably take this, although Governor Pritzker, you're welcome to. This is from Jonah Meadows at patch.com. The governor said Monday 29% of known cases are currently involved in tracing, and that the industry standard was 60%. To move to phase 3, the Restore Illinois plan calls for, quote, begin contact tracing and monitoring within 24 hours of diagnosis. While moving to phase 4 of the plan and open schools and restaurants requires the government to be able to, quote, begin contact tracing and monitoring within 24 hours of diagnosis for more than 90% of cases in region.
Yeah,
Charlie says, but IDPH does not publish any data on the status of that metric either by region or statewide. So in what percentage of cases does tracing begin within 24 hours statewide, and will that data be published by region?
I'll let Dr. Ezike give you the last half of that, but I just want to be clear that it's the 90% of the possible contacts. Remember, many people who are contacts of people who have COVID-19 aren't reachable or don't want to be reached. And this is the case if you look at the Massachusetts Contact Tracing Collaborative and really all contact tracing. Anybody who's been in that world will tell you that just because you call somebody, it doesn't mean they're going to pick up the phone. Just because you knock on their door doesn't mean they're going to answer the door. And there are many people who don't give their information, or we don't have information for. So I'd be happy to have Dr. Zike give you the rest.
Yeah, thank you for the question. So, of course, this is a robust effort that is, we're laying all the seeds now. Obviously, we have said before that the amount of staff that we will need to be able to reach all of the people who test positive exceeds what we have within our local health departments and our state health department. And so that is why we've put out the interest letters to identify people in the state who would like to participate in this effort. We're working with academic institutions. We're working with medical schools to identify a student, medical student, and nurse volunteers who want to participate in this effort. So all of that is being laid, that foundation, so that we can start getting up to those very ambitious goals, which we need, which will help us decrease the transmission of spread by identifying people early and having them, stand down once they find out that they've been exposed. So again, all of this is happening. The work is going around. Again, 24 hours a day, people are working to get this in place. We wanted to get those goals that you cited, and so that's what we're aggressively working on as we get to phase 3. So the clock is ticking on us so that we can try to meet those metrics, and we will be sure to keep you posted as we go along that journey.
All right. If I can find it, pardon me for a moment.
John, this will be your last one, so you're going to work.
And I am. I'm sorry. Smartphone's too smart for me. I can't find it.
Great. Mark?
Hold on, wait.
Oh, I'm sorry. Yeah.
Hi, Governor. Friday, IDPH filed this emergency rule. You've addressed this somewhat. Walk us through the thinking there. It labeled these businesses like restaurants, gyms, hair salons, high risk. You said that's already in the law, this Class A misdemeanor. Then why file the rule at all? It seems you're searching for some way to punish businesses who defy your order.
Again, looking for an enforcement mechanism for people who aren't following the rules, right? They're putting their communities in danger by opening their doors when they are not eligible during phase 2 to open their doors. So they're just flaunting the law. And so the idea here was to give some method short of the very draconian methods of closing the business or of taking a license away.
Sure.
That was the intent.
It's true, you have said all along for months that you didn't wish to jail anyone, but you did say you could yank their license. And in fact, some state licensing agencies have already reached out to businesses who defied them and threatened that very thing.
That's right.
So I guess in repealing this rule, are you acknowledging that you exceeded your executive power?
No, what I'm acknowledging is that we would rather not take away somebody's license, that we'd rather have an enforcement mechanism that was at a lower level. And again, that's what I think Leader Cunningham's bill will allow us to do.
So all prior communication from state licensing agencies, should those businesses accept that those are also being repealed, no longer valid?
Well, again, if somebody continues to be a scofflaw, if some business continues to not follow the rules, there is the potential for those other enforcement mechanisms. We'd rather start with something that's lower level.
I wonder if you worry about, I know you've said you listen to these business owners and certainly to the protesters. Do you worry about the political implications of the position you find yourself in here? As President Trump urges many governors to reopen more quickly, some of them are. Many of these states that had lesser restrictions than we have in Illinois are moving in that direction. I know you've said you want to err on the side of caution and science, but at what cost? Do you worry come November that President Trump can look at states like Illinois and say, look, they were holding businesses back longer?
First of all, President Trump isn't following science or data. And second, if you look at really all the polling data, as you'll see, the vast majority of people in the United States want us to follow the science and the data to get this right. And of course, we also want to reopen businesses. I've been doing that all along, looking at and figuring out how we can open more and more businesses. This is another way, the announcements that we made today is another way to make progress. But we're doing it right in Illinois. We're not the last or the first. I think we're cutting the right path here so that we can, again, the number one consideration, keep our people safe. Make sure that our first responders are taken care of. Make sure that we're not overwhelming them. These are our heroes. I mean, these are the people on the front lines who are risking their lives every day. And when there are scofflaws out there, when there are people who don't follow the rules, they're literally thumbing their noses at healthcare workers. And so I want to follow the science and the data because we want to make sure keep people safe and we'll protect the people who are on the front lines who are keeping all of us safe.
I see. A question from the managing editor at Channel 5 in Chicago. With these rules that you're relaxing outdoor gatherings and businesses allowing some outdoor seating and this modified phase 3 you've announced today, how does that change your plans for childcare and summer day camps?
So we're continuing to look at the rules for childcare. We'll be issuing some of those rules. I talked about the industry groups that we've gotten together all along here to not just the restaurant industry as we've talked about today, but many of the others, manufacturing and so on, including childcare. So those rules will be issued and they'll be for childcare providers. They'll be able to see what is available and how they can expand their operations.
Perhaps you can elaborate on the contours of what that may look like. You said you're in touch with faith leaders. Another example, we're hearing a lot of questions from reporters as well asking, one example, the Bank of Springfield Center is a big venue. Many churches might have similar floor space like that. They've got more than 150 people in there today, but right now churches are limited to 10 people in their building. What if they've got other rooms or more space? If they have expansive venues, can your phase 3 or phase 4 account for that?
You can see Dr. Ezike nodding her head too. She too is a person of faith, and we all want churches and mosques and synagogues to be able to open safely. And so we've been looking at all the ways in which to do that safely. As you know, the Catholic Church came out with a plan. It's a rather comprehensive plan that includes a webinar and, how you perform a funeral or wedding and so on. And each one of the faiths have come forward, or at least a number of them have, to ask, how could we do it safely? And to put forward their ideas for getting it done. And we're trying to work through all of those because, as you know, each building, each situation is slightly different. What we did want to do, though, is make sure that people understood outdoor is much easier, drive-in is much easier, and setting rules around that immediately or very soon.
A lot of questions about the legislature they're convening here today. From Taman Bradley at WGN, how disappointed will you be if the legislature does not pass meaningful ethics reform in this special session? And if I can add one more, you promised at the start of this session as well, significant property tax relief for Illinois homeowners. Those two things are not clearly labeled on the special session agenda.
Yeah.
Should lawmakers make the time to get it done before they dismiss?
What I can say, and maybe the leader wants to weigh in, but I'll just say this, that look, there are 3 days of session planned, as I understand, and it's because of this pandemic, right? I mean, this is highly unusual. I think all of us are recognizing that. The circumstances in which the legislature is meeting. I'm glad that the legislature is meeting, but in order to get everything, from the highest priorities done, there's a limited number of things that they can get done, and I think you've heard some of those already from the leaders themselves. So I would very much like to see ethics legislation get through. I think we all think that you can't get the ethics, if you don't get something done in the next 3 days, it can't possibly be done this year. And the answer is that's not right. There is the rest of the year. I think the legislature is meeting these 3 days in particular. At least the number one concern is the budget, and the number two concern is a COVID relief package, because we've got to help people across the state. But there's an opportunity, and you know that I've worked across the aisle for the entire time that I've been governor, listening to Republican legislators, as well as my friends in the Democratic Party. And so I really believe that there's much more that we can get done later in the year.
On the budget-making process, from Hannah Meisel at the Daily Line, the proposed budget, I think she's referring to one bill that's been filed, would cut the state's breast and cervical cancer screening program by 40%.
No, I won't stand for that. I read her column this morning. You can let her know. And I won't stand. I mean, that's just wrong. I know that the intention was good. The intention was that the money hadn't been spent. The money that had been appropriated, it wasn't being spent because so many more people who need that service are actually being covered by insurance now. Having said that, we need to make sure that that fund, that those dollars are available for everybody who needs them, who falls into that gap that Hannah talked about this morning in her column.
You've already illustrated the budget holes as income tax, sales tax, corporate income tax dry up during these coronavirus closures.
Yes.
How then, how then do you account for that in this budget-making process? Where are you going to go? Do you have to make cuts? Do you have to raise some fees? For example, I believe the CTBA has suggested fees on attorneys' practices. Are there any ways you can go that might be more progressive in nature that target maybe like white-collar jobs that are more insulated from the coronavirus? Can you look for revenue in those areas?
Yeah. So as you know, I put forward a budget back in February. Things have changed quite a lot, but an outline of that budget, the outline of which the legislature took upon itself and then worked in their working groups to try to figure out how do you address the shortfall of revenues across the board. They have talked to many members of my administration to get help in putting those numbers together. So there really is a cross-functional effort to try to get a budget agreement put together, and you see a lot of work has been done by legislators, even though they haven't been able to meet.
You're getting a crash course in the regionalization of politics in Illinois right now. Part of that was the minimum wage fight. A lot of regional Democrats and Republicans asked about that. I think Senate Majority Leader Kim Lightford mentioned that she's looking at, or she's hearing about this idea to modify the tax credits that were in part of the $15 minimum wage to go from $50 employees up to 200 to expand that, considering many of these restaurants and bars are the ones who are paying these wages. Do you support an idea like that, to raise the threshold up to 200 or so?
I do. In fact, I've been talking about that really since early on here, expanding. There's an original tax credit that was put in place when the minimum wage was raised. As you know, this is a 5-year, there are roughly 5 years left in the ramp of the minimum wage. And I think would be helpful if we were able to expand that tax credit to give businesses the opportunity to get a little bit back on the increase in wages that they're offering to people.
Yeah, a question on ethics. You've addressed a number of businesses already in the last 2 days that the Pritzker Group has invested in that provide COVID-19 testing in some cases, or in others, maybe working with major biotech or pharma companies as they race to produce a vaccine or a treatment in these ways here. So on that potential conflict of interest, before your inauguration, you pledged that any time a company of yours has proceeds or profits from government contracts, you'd give that money to charity. Does that pledge still stand today, and does it extend to other reimbursement or funds that come from government in addition to contracts?
Well, let me be clear that, as you know, 3.5 years ago now, I stepped away from my business interests entirely. And then about 1.5 years ago, a blind trust was created so that I really have had no involvement with any of these businesses for 3.5 years. Don't know what they're pursuing or what their interests are. And so, to be clear, this is not something that I'm engaged in any way.
I don't even
know that they've gone into that business except for your report.
It's public information. It's in their press releases, and it's on your statement of economic interest. It's in your tax returns. Would you then pledge to release your full tax returns, just so Illinois can see?
Well, as you know, the way that you know all that information is the statement of economic interest. And I did, in fact, release a multi-page, I don't remember how many, a dozen or more pages.
4 pages.
Of
tax returns?
Well, no. A dozen pages or more of my statement of economic interest, which is where you see listed each interest that I have any interest in. In fact, much more comprehensive than anything that you would see in a tax return. So, to be clear, I have no involvement in these businesses that you're alleging that that are owned and operated or doing something. And as far as I know, there's no business being done by any of them with the state of Illinois.
Okay, but just to reiterate, they are a part of your portfolio today. Will you donate any of those proceeds from government contracts or reimbursement to charity?
I believe it said Illinois contract.
It did, but
Yeah, I'm happy to if there's something that they're doing in Illinois. Yeah.
Okay, questions for Dr. Ezike real quick. We've been monitoring.
It's going to be your last one.
Okay, understand. You mentioned today a decrease in ventilator use, but we're also hearing from a lot of doctors who say that they're going to the ventilator a lot later on and not quite as often. Why then is that an important metric to still follow if the ventilator itself isn't being utilized as heavily? And if I can just ask a question about the interaction, to a two-parter here, between you and the governor. The state law gives IDPH a lot of discretion and authority in these times of emergency. Are there any examples or illustrations where you've cautioned more severe restrictions and Governor Pritzker has pushed back because he wants to get perhaps business going faster? Are there any examples that you can share with us?
Let's start with the first question. So when we talk about the metrics that I've been talking about for all these days, we've been talking about both the number of people in the hospital with COVID as well as the ICU, people in the ICU part of the hospital, as well as people in the ICU on ventilators. And so for the number that I cited, which was the number of people in the hospital, that is the lowest number since we've been calculating total number of COVID patients in the hospital. So yes, what you cited is true in terms of some of the science of what we've learned about in terms of taking care of COVID patients, the very severely ill patients, is that the response on the ventilator has not been good. And so I've talked to many pulmonary ICU, intensivists who are actively, on the battleground, on the battlefield, and they said, yes, we're trying to keep them off the ventilator. But these other metrics still are significant, that we have decreased the number of people that are in the hospital. The total number of people are under 4,000. That's the first time we've reported that. And that we have, usually that would follow that the amount of people in the ICU would go down, because that's usually a pretty consistent number. Facing your second question, we work in lockstep. I mean, we're even coordinating outfits, as you can see. So everything that we do is working towards the good of public health. As I tried to mention, my public health champions, let's not forget that we would absolutely induct Governor Pritzker as a public health champion. He's a master of laboratory science, knows everything about COVID testing, and he's followed the science, knows the parameters, knew all the different plans that the White House had, the metrics that we should be following, has been such a proponent of contact tracing. So we are on the same page. All of these decisions that have to be made, they're so nuanced, and there's no Bible that says what is absolutely the right answer and the wrong answer. So it's all about thinking through, applying the science, applying the epidemiology, getting input from local health departments, modelers. Like, it's such a collaborative effort on so many levels, and so you come to a final decision after weighing all these things. And so I support his decisions. If I have something that I think is a very important consideration, I absolutely bring that up. He's always hearing what I have to say. So yes, we're working together, and we will continue to do that throughout this. This is really the hard stage, closing, doing the shelter at home, stay at home, that's easy. Stay at home. It's not nuanced. It's pretty clear. But now, as we get into this nuanced stage, there's a lot of different ways to go, and so we're working together to find the best way forward.
Okay, we'll go to some questions online. Chris Ty at WBBM. Suburban Chicago mayors outside Cook County asked not to be a part of the Northeast Health Region. They say you won't meet with them to discuss their concerns of being last to normalize. Do they have a point? Why not meet with them? I don't know what that last to normalize means.
Yeah, I'm not sure either. The whole state is moving forward, it appears, if you look at all the metrics, from phase 2 to phase 3 in less than 9 days. So that's going to happen. In terms of meeting with people, I mean, as you know, I've been in isolation for the last, I'm not sure, 10, 12 more days. And furthermore, I've been willing to listen to really everybody. I've made calls. I've discussed this with mayors all across the state, some who agree with me, some who disagree with me. Most importantly, people have offered me good ideas that are being incorporated. In fact, you saw that on May 1, we made changes to the stay-at-home order that included things that had been asked of me by Republican legislators and by Republican mayors, as well as Democratic mayors and legislators. So, I've been willing to listen and make a lot of changes, and people have sent me, I can't tell you the number of plans that have been submitted to me by different individual cities, counties, groupings of cities. So it's been a helpful exercise, but it's my job here is to try to synthesize all that and then go to the epidemiologists and say, what can we do? In many ways, and maybe this is in part in response to Mark's question, in many ways, I come to Dr. Ezike and her team and I say, what about this? Can we do more of this? I got this idea from a mayor or from a business owner or an employee of a business. And, and I say, can we do this? How would you do this? When could we do this? Why would it be allowable then and not now? And those are kind of the dialogue that we have about quite a lot of things. My expertise, if I can claim one, is that I was in business before I became governor. That's something that I know a lot about. I'm not an epidemiologist. I'm not a doctor. I'm not a public health expert. And so there's one thing I've learned in life: know what you don't know and be willing to ask for help.
Okay. Shia at Politico, can you talk about what the gaming board is up to? If they're not furloughed or overseeing closed casinos, are applications being approved for them to come out of the gate to start building casinos approved for the capital plan?
We're very interested in making sure that the gaming board moves forward, and in fact, we've made changes so that they have the ability to meet, and so there'll be rules that will be promulgated going forward.
Jim Hagerty at Rock River Times. Governor, will the state be offering financial assistance to business owners of restaurants, gyms, and salons who could be forced to reinvent themselves in order to operate under potentially significant social distancing guidelines?
That's my hope. And in fact, I think the PPP program in Washington, which missed a lot of these smaller businesses, that's where I want to kind of try to fill in the gaps. PPP seems to have only been available to medium and large-sized businesses, and the very smallest businesses are the ones that really need help. So that's why you heard me last week ask the legislature for help in the COVID relief package that they're talking about to provide that kind of support.
Sometimes, can you detail the fines on the new legislation? Is it a daily fine? Should businesses not follow the order? Also, regarding the bars and restaurants, can a bar that does not serve food have outdoor seating during this time?
Still being worked out. On the outdoor seating, I would defer to Sam, if I may, in a moment, but I just want to say, but we're talking to the legislature, to Senator Cunningham, Leader Cunningham, about exactly how we would implement that. He's given you some, broad parameters, but obviously he's got colleagues he needs to work that out with as well. So, Sam, do you want to talk about outdoor seating?
So, excuse me again. So on outdoor seating, obviously it's the local municipalities that give those licenses out. So we're working with, cities throughout the city and towns throughout the state of Illinois here to see what they're going to get creative, because I'm sure there might be restaurant bars that might apply for an outdoor sidewalk cafe, and then we'll see if the local municipalities, what they're coming up with. So like the governor says, there's still 9 more days before we can open up slowly the economy here. And the one thing is that I know that the governor and his team and all municipality leaders know social distancing. So that's number one. So if they come up with a plan, that they apply for a sidewalk cafe, maybe we close parking lots, maybe we close bus lanes, bike lanes, streets, we don't know yet, but social distancing is number one. And then, can we do the social distancing and do drinks? They used to be called bartenders, now they're called mixologists. So yes, people would like to go visit some places and have some drinks from mixologists. So.
Marty Pike has one that you could probably answer too, Sam. Should people have to wear masks while they're outside at these restaurants? Should servers wear masks?
We're working on PPE. It's very important. Obviously, hand sanitizers, obviously face covering, gloves, social distancing, like I said, is number one. So yes, we always say do not go against the governor's executive order, so everyone should wear their mask. Obviously, they need to take their mask off when they're eating, but if they go to the bathroom, when they leave, they put their mask back on. So yes, again, we are working on guidelines, but we're listening to the scientists and doctors, because the number one thing is we don't want to open the economy and then close it again, okay? That is what restaurateurs, bar owners totally understand. That would be the death. So again, we want to listen to the scientists, doctors, work with our local leaders to, help the bars and restaurants.
This will be our last question, because I just got an email from a viewer who watches these live who said this is going on too long. Yvette Shields at Bonfire. Governor, can you provide additional details on a proposal to issue up to $4.5 billion of short-term debt through the Fed's municipal liquidity facility? Is it the state's intent to issue the full amount?
We hope not, because there is a state and local funding bill that is working its way through the Congress even now. Whether the entire HEROES Act gets adopted by the Senate, unclear, but it is reasonably clear to me that Republican governors and Republican senators need to support their states just as much as Democratic governors and Democratic senators do. And so I think that we're going to see a state and local funding bill go through the Senate. Can't tell you exactly when. So our hope is to not have to access that window that's been made available to states, but we will if we need to.
All right.
One final one. Representative Bailey just now being voted out of the House. Can you respond to that, or to maybe the risk of you being in that building with so many people without a mask on? What's the danger there, and what's the political ramification?
I think all of us have been educated on the why we want to use face coverings and what that does. I think Governor Pritzker has explained that eloquently many times before, that when you put on a face covering, you're trying to collect your secretions from when you talk, laugh, cough, whatever you might do that's going to release these droplets. And so being able to kind of capture that really can decrease spread of whatever we're harboring. We don't know. As we know, there's a growing percentage of infection that's transmitted when someone is not even visibly ill, doesn't know that they have the virus. It's asymptomatic or pre-symptomatic. So if we want to try to be as respectful as we can to people around us, and if your health situation allows you to wear a face covering or mask, that's a very simple gesture which helps you protect people from what you may know to have or may not even know that you have. And so anyone who doesn't want to do that, it brings into question what that signifies. But I'm just saying that when you do it, you're definitely decreasing your risk of transmitting any kind of virus. And there are other viruses besides just coronavirus, but transmitting anything that could be harmful to someone else.
Well, the representative has shown a callous disregard for life, callous disregard for people's health. You just heard a doctor tell you why people wear masks in the first place. It's to protect others. So clearly the representative has no interest in protecting others.
Thank you, everyone.
Report.